Hey there, healthcare professionals! Today I am bringing you some exciting news about a breakthrough treatment for spinal muscular atrophy, or SMA, in infants. Chugai Pharmaceutical Co. Limited has just filed a regulatory application with the Ministry of Health, Labor and Welfare in Japan for Evrysdi dry syrup 60 mg for an additional indication in pre-symptomatic SMA and an additional dosage for infants up to 2 months of age. So why is this such a big deal? Well, initiating treatment before the onset of symptoms can potentially maximize the benefits for these infants. Evrysdi is the only approved oral treatment for SMA, and having it available for all ages, including infants from birth, could mean that treatment can start promptly after diagnosis. This is a huge step forward in managing this serious condition. The application is based on the promising results from the Rainbow Fish study, an overseas phase 2 study that focused on pre-symptomatic SMA infants. These infants had 2 or more copies of the SMN2 gene, and generally the fewer copies of this gene, the more severe the disease. The study met its primary endpoint with 80% of the primary efficacy population, which consisted of 5 babies, being able to sit without support for at least 5 seconds after 1 year of treatment with Evrysdi. This was assessed using the Bayley Scales of Infant and Toddler Development, 3rd edition, or BSID-3. For context, these primary efficacy population babies had 2 SMN2 copies and a CMAP amplitude of =1, 5 MV at baseline. That's a low score correlating with the onset of symptoms in SMA patients and worse functional outcomes. Without treatment, children with type 1 SMA wouldn't be expected to sit. Of the 26 babies in the study, 81% could sit independently for 30 seconds, including all patients with low CMAP amplitude at baseline. And many were even standing and walking. This is a remarkable achievement. Now, let's talk about adverse events, or AEs. Most AEs were more reflective of the baby's age, rather than underlying SMA. The majority weren't considered treatment-related, and there were no deaths or AEs leading to withdrawal or treatment discontinuation. Common AEs included teething, COVID-19, pyrexia, gastroenteritis, eczema, and constipation. These AEs are generally consistent with those seen in other Evrysdi trials in SMA. In SMA, the loss of motor neurons can begin before symptoms start, so initiating treatment early is crucial for better outcomes. Newborn screening plays an important role in early diagnosis. Evrysdi is expected to offer high medical value by enabling immediate treatment start after diagnosis. The Rainbow Fish study, NCT03/938-4, was an open-label, single-arm, multi-center study investigating the efficacy, safety, pharmacokinetics, and pharmacodynamics of Evrysdi in babies from birth to 6 weeks of age who had genetically diagnosed SMA but were not yet presenting symptoms. The study's primary endpoint was the proportion of infants in the primary efficacy population who could sit without support for at least 5 seconds at month 12, assessed by the BSID-3. Japan wasn't included in this study. Evrysdi is a survival motor neuron 2, SMN2, splicing modifier designed to treat SMA caused by mutations in chromosome 5q that lead to SMN protein deficiency. It's designed to increase and sustain the production of the SMN protein, which is critical for maintaining healthy motor neurons and movement. To sum it up, Evrysdi represents a significant advancement in the treatment of SMA, offering hope for improved outcomes for infants diagnosed with this challenging condition. Keep an eye out for more updates on this groundbreaking treatment. Thanks for tuning in and stay informed.